You're listening to Health Nuts with Dr. Chris Carr. Making lifestyle changes is hard for many people, and not knowing what to do or how to do it makes the task all the more daunting. Here at Health Nuts, we focus on helping you live a fuller life by discussing everyday health issues and exploring breakthrough solutions on how to overcome them. And now, here's your host, Dr. Chris Carr.
Hello and welcome back to another episode of Health Nuts. I'm your host, Dr. Chris Carr, and I'm so excited to have on today Dr. Jonas Marry. Quite honestly, one of the brightest and most knowledgeable doctors I have come across in the chiropractic field, but especially in neurology and detoxification. So today is going to be all about detox and how your body can become healthier than it has ever been before. A little info about Dr. Marry. Dr. Marry is a 1999 graduate of Parker School of Chiropractic, where he also completed his BS degree in anatomy. He has completed extensive postgraduate work in the areas of pediatrics, sports, bio and neurofeedback, as well as neurology. This has been foundational in building a practice that not only serves whole families, but youth, high school, and professional athletes, as well as Olympic and international competitors for the last 18 years. Because Dr. Marry's continued research and study in the field of functional neurology and functional medicine, he also has developed collaborative care plans for patients with autism, cerebral palsy, anxiety, and depression disorders. He has written and produced his own TV show for a local cable network and has served as head instructor at the Carnegie Mellon University. In addition to, Dr. Marry has lectured extensively in the area of a variety of organizations, most notably Allegheny General Hospital Symposium on Spinal Health and the Pennsylvania Counselors Association's annual conference. Dr. Marry continues to teach basic and advanced classes on chiropractic, neurophysiology, healing, wellness, and performance in his McMurray office for the past 17 years. That is a mouthful, my friend. It's so good to have you on.
Thank you. Thank you for having me.
You got it. So, in your own words, that's kind of the formal introduction of you. Tell us, describe yourself. Tell us about yourself.
I think probably the biggest thing is the family practice. I think that's probably the most important thing. Yeah, I've been working with sports, and I was actually going into sports in terms of what I was going to do with my whole career. But my wife got pregnant when I was in school, and that changes everything. You have a little one now, and you know that once you have kids, everything changes. So it is. I got hugely invested in pediatrics. And from that point forward, the whole growth, developmental aspect kind of brought the neurology piece. But family's been our key from the beginning. That's our focus.
Awesome. So you've been in practice. You got a couple, you're not that long in a tooth, but you got 17 or 18 years under your belt. So
yeah.
With that, that's a ton of patience. That's a ton of experience. And, in speaking with you, just because you're a friend of mine as well, and speaking with you, it's so knowledgeable. You haven't quit learning. You're also back at it and doing some neurology work as well.
It piqued my interest. After a while, it's easy to get bored. Mm-hmm. And I really wanted to stay current with what was going on. And chiropractic is neurology. From day one, everything that BJ did way back when, the developer of chiropractic, was neurology based. And I thought, we've got technology now that's proving what he was saying over 100 years ago. We can't ignore that anymore. There's just too much good information out there. And with the rise of things like autism and other learning disorders, the things that are associated with that, it's helping bridge that gap.
Yeah. So with all that being said, we have all this research coming out, and one of the things we want to talk about today is neurology, but also how detox, how it's going to play a role,
right?
How chiropractic can play a role in detoxification. So that's just going to be some nuts and bolts we're going to get into for today's topic. Before I start, I always like to start off these podcasts on just a positive affirmation or quote, something maybe that's stuck by you throughout the years, something you want to share.
I gave some thought to that, and I'm pretty steeped in my Christian religion. And there's a quote in there that it sounds a little ominous at first, but I think it really applies to what I do every day. And that's that my people perish for lack of knowledge. And I do think we have a lot of people suffering, a lot of people really going through some very difficult times for themselves and with their kids because they just don't know.
Yeah.
And I think we have to get, you doing things like this is so critical for patients and just people in general to get out there and understand, wow, there's more to this story than I realized. And I think we get that knowledge out there, we change things.
Yeah, and it's so true, because one of the podcasts I did earlier in the week, we were talking about there's so much information out there, and a lot of times we just go straight to the internet and just kind of consult a local blogger for information, where it just ends up not being the case. And that's why I hope with today you can give some clarity to the knowledge, and especially the topic of detox. So I want to get into this subject matter. So why is it important, first off?
With one of the first things I learned in some of the neurology side that we're doing is you can't possibly upregulate a system if that system isn't working properly to begin with. So if we've got somebody who is struggling to do basic functions, basic metabolic functions, it's almost impossible to get some of those areas up and running. So I think detox in that sense is absolutely essential. They can't do the extra work.
So somebody who might be new to this, what are some maybe signs and symptoms that something's taking place in their body, maybe they have some warning signs that are starting to pop up? What are some things maybe they should be looking for?
You know what? One of the biggest detoxers in your body, obviously, is the skin. We know that the liver's involved. People know that their intestines are involved. I think people forget all the time that the lungs are very much involved in ridding the body of toxins. But skin's probably the easiest one you can see. But if we're having chronic congestion or skin eruptions or fatigue, headaches, all those things are absolutely associated with, toxicity in the body. Even the brain fog component, that is brain toxicity.
And so you have maybe some of these warning signs that are taking place. We always use, especially in chiropractic, we always use the check engine light will pop on.
Right.
And in Western medicine, when the check engine light comes on, typically the patient either kicks the can down the road, they go to the local pharmacy, or they go to their doc and maybe get a prescription to cover up said warning sign. What are some things that the patient can do naturally if they have these warning signs, if they know they need to do a detoxification or a cleanse? What are some things that they can do, and how would they do it?
I just did this with a woman who'd been suffering for a year, and I'd seen her in the past, but I hadn't seen her in some time. And she was struggling with some skin eruptions and some chronic irritation. And she finally came in and she said, I've been to my PCP, I've been to the dermatologist, I've been to the endocrinologist. And I said, sure, you left me for last. We're always on that last part, and I gave her a little bit more time. Yeah. So we did a couple of things, and she had gone away. I just saw her back the other day, and she goes, it's all gone. I've been suffering for a year, and it's gone. I said, what'd you do? And she said, I actually did what you told me. So, one of the big things that I really wanted her to focus on was, one, just getting her hydration up. People are not drinking enough. It's half your body weight in ounces per day. So if you're not hydrated, you can't cleanse. So that was a real simple one that we just started with. The other thing was, these sound a little bit weird, but they're super effective for getting the nervous system, or the part of the nervous system turns on that does detox you, and that's your parasympathetic nervous system. So I gave her 4 little activities. One is to gargle every day. When you gargle, the action of gargling, so it's not so much what you gargle with, you can gargle with anything, but the action of gargling actually stimulates your gut. Loud singing does the same thing. I gave her deep breathing because we want good respiratory mechanism, and that stimulates detox. And the last one I gave her is gagging, and this is the one I get the most pushback on from patients. When you're brushing your teeth, just really gently reach back on the right and the left, because there's 2 parts to that motor pathway, and just a real gentle gag. And that was it. And she did those things. She was going away, like I said, on a vacation, and she came back. She goes, I've never felt so good. So odd, but they're very effective.
And those are things that really the layperson's going to have no idea about. They're never going to read about that unless they see someone, because it's so opposite of, you're telling someone to do a light gag, and it's the same thing as it's kind of just not on the spectrum of it. That's going to be the opposite of kind of what they might be getting told.
Right.
We get told all along that a fever is bad, digestive distress like diarrhea and constipation are bad. Right. When it's actually your body's doing exactly the right thing at exactly the right time.
Yeah, I agree.
Yeah. So what else? So what about foods? So the standard American diet, as you're well aware, because you see a ton of patients, the standard American diet plays a major role in this because of the process and just the stomping on the food supply that's out there.
Yeah.
What foods, what would you say for dietary things?
Well, for her, she was struggling a little bit with, and I see this actually a lot. She was struggling a little bit with just getting adequate protein in, making sure her protein requirements were being met, and most of all, before anything else, that these foods are clean. We're under the assumption that this is as clean a source as you can possibly get. So she needed to get adequate protein in, and then we're moving on to veggies. I mean, we're just not getting enough. The cruciferous vegetables detox the liver like crazy. The Brussels sprouts and cauliflower and essential.
Huge.
And then, yeah, it really is. And then we just talked about staying away, obviously, from the processed foods. She was going to be on a cruise, and just, it doesn't have to be that situation, but people are busy, and I think they're stopping a lot. And at least, things like Chipotle are picking up, and that's not a McDonald's Big Mac. But they're making a little bit better choices. But we have to get real food in our bodies. And last is fat. We're not getting enough fat. Everybody's afraid of it because they think they're going to become fat. It's really sugar that's driving that process. And that was the other big one. Sugar has to go. It's just so inflammatory.
So there's a ton of foods you just hit on. I want to kind of go back just a little bit. So you were talking about protein intake. And I think protein can end up being sometimes a catch-22 where some people take in too much. We know if you take in too much protein, then it gets converted to sugar.
Right.
What is your recommendation for any kind of like ballparkish specifics on the actual protein intake?
Yeah, what I do with patients is, depending on their lifestyle and what they're actually doing, because there's some people who are high activity athletes, so their needs are going to be greater, and it's got to be unique to the individual. So we go with a range. And I try and keep them in a quarter to a half their body weight in grams per day. So, for me, I'm about 200 pounds. So that puts me anywhere to 50 to 100 grams. But if my activity is not real high, I'm not way up there in my protein intake. Now, if, like you said before, people will go online in a second. And if you get near any of the weightlifting sites, they're talking about a gram per pound. And first, I can't eat that much. I don't know everybody could eat 200 grams of protein a day.
It's going to be terrible in your gut.
It is, and it's going to be hard on their kidneys, and it's going to be hard on their body in general. So I think you're exactly right. We get way out of control sometimes with what we're putting in and what we're not. So I try and give them a range. A quarter to half their body weight in grams seems to be effective depending on their activity levels. Awesome.
So we got a couple things. So we got half your body weight in ounces of water. We got the protein taken care of.
Right.
But when we're detoxing the gut, you hit something about the veggies.
Yeah.
And fermented food, we know, plays a huge role in this as well. It's stronger than any probiotic that's on the market just because of how many strains of bacteria are in fermented food.
Right.
What would you say about fermented food and how that plays a role in detox?
I think we don't consider it enough, especially with, like you said earlier, the American diet being what it is. I think we don't get exposed nearly enough. And I find that patients, when they start, hearing that these are foods we need to get into our diet, they struggle a little bit. They also struggle because their guts aren't in that great a shape to begin with. And that food hits the body and starts making changes. And a lot of times, you mentioned the indigestion, the diarrhea maybe that happens, or the fevers that we talk about. People think these are bad things, when really they're really good things. And we need to give the body a chance to kind of clean itself up. So I think patients kind of push back a little bit sometimes until they understand better why this is important.
And when we talk about specific, such as a detox or a cleanse, and to get into kind of some more the advanced science with all this, we know the body's made up of trillions of cells.
Right.
And those cells, especially with a lot of times people think about detox and cleansing when they need to lose weight.
Right.
When those cells are toxic, we know that oxygen can't get into them, and then the toxins can't get out of the cell.
Right.
How do you recommend on a cellular level? Is there anything you can recommend for somebody to do to help detox on either not so much on an advanced detox, but on a daily basis outside of the nutrition?
Yeah, you know what? I want to get them into. I want to get them active. Mm-hmm. I think it's absolutely essential that they start moving. That's the other thing. We have sedentary lifestyles, and people are not moving metabolically. They're not processing like they should. When it comes to the nutritional piece, if I'm actually going to do something nutritional, if I'm going to make a recommendation, we will use things like cruciferous complete or something like that to help drive phase 2 detox in the liver, so that their body can actually begin absorbing nutrients and getting rid of those other toxic loads. But movement is so simple. Manual lymphatic drainage, which is, you can have that done somewhere, but we teach to our patients. Absolutely essential to get their body up and running like it should, so that they can begin that process. Because a lot of times people will say, I think I have this toxic load. What can I take to get rid of all this? And my answer is always the same. If you're toxic and we dump all this stuff into your body with some detox, product, because they will detox you. But if you're already toxic, that means you couldn't handle the load to begin with. When we dump it all back in your system, you're going to really be in trouble. So we try and do that gently, but give them day-to-day activities that they can do where they can really be effective and start taking control back of what that looks like.
You're still right. So I think a lot of times we want everything done yesterday for us. We don't have the patience to take the time and either do the things that we're talking about because we want to have that quick fix, the massive symptom. We don't want to put the time in to do it.
Right.
And it's just kind of the nature of society. But so with that being said, with the detox that's taking place, cleansing, like the difference between a detox and a cleanse. So what's the difference between maybe like a specific colon cleanse that somebody's done, whereas maybe like a full body detox?
Well, I've seen, in fact, when I was in school, this was really, really popular. There was a product out there, and I don't remember the name of it anymore, but people were buying it like crazy to do a detox. And as a result, some people who were kind of healthy to begin with weren't really struggling too much. But we're seeing, some effects, some positive, some negative. Whereas the people, I think, that were approaching that from a more holistic perspective or a whole body perspective, they were taking a little bit longer, but they were having much better outcomes.
Okay.
We weren't seeing as many people get sick. We weren't seeing as many people have relapse of symptoms. There was one woman in particular that had a procedure years ago, and she had gotten really sick. She had a reaction to the anesthesia, and she had not processed it all out of her body. And she did just a real basic push everything out of my body detox, and she had a reaction again. She was actually hospitalized for it because she was holding toxicity in her body, in the subcutaneous tissue. So, I think being really careful about, I like that whole body approach. I'm going to get my nutrition. I'm going to do certain activities day to day. I'm going to be smart. And most of all, I'm going to get with somebody. I know you do a lot of this work with your patients. I'm going to get with somebody who knows what they're doing and follow their directions and can walk me through step by step and really pay attention to the signs of that process.
Yeah, take the guesswork out of it, right?
Yeah, absolutely.
And now that's kind of a good segue into the really important topic of tying this all together.
Right.
So neurology, which you're just a master at, and
I wish.
Yeah,
I'm getting there.
You're getting there. Right?
I'm getting there.
How would you tie that in with? I think it might be hard for some to grasp that there's actually a connection between getting adjusted, going to see a chiropractic doc that's either very educated in neurology, functional medicine, and how would you tie that together for a layperson?
That's actually my favorite topic. How much time do we have left?
Yeah.
You know what? Some of the most recent research, and this research is coming out literally daily. Parkinson's primary pathway, the causative pathways in the gut. There's two primary pathways. One is gut, and the other is the nose. So the research that's literally come out maybe 2 months ago is showing that if you have an unhealthy gut, your likelihood of Parkinson's, dementia, Alzheimer's, any of the neurodegenerative diseases, including MS, is much higher, like significantly higher than if you have a healthy intestinal system and a healthy detox system or protocol in your body. Mm-hmm. So if we don't have good gut function, there's no way to have good brain function. If we don't have good brain function, you can't have good gut function because your brain and gut are constantly communicating back and forth. So we're looking at those patients, or what I would say to prospective patients, or even somebody who's trying to understand this better, is you have to have good neurology to have good physiology. And if you don't daily support your physiology, your neurology will never be what it should. So there's no way for brain function to be adequate. But too often patients or people in general, I think, are getting into a place where they think, well, this is normal aging.
Right.
This is what happens when you turn 60 or 70 or 80. And that's not true at all. We know from the research that aging is common, but it isn't normal.
Right.
And we have to really start separating between average patient out there, or the average individual out there, versus what's actually normal. You mentioned the temperature a little while ago. Everybody knows 98.6 is the temperature you're supposed to be. That's just the average. Not everybody's 98.6. Right. So if we start to, I think, approach this a little differently and really look at the role chiropractic plays, because we're the only doctors that really look at central nervous system other than a neurologist, but they're there for pathology and treatment of end-stage disease, where because of our functional hands-on approach, both of what we can do nutritionally or chiropractically or in a rehab model, we know that there's a 20-year window before dementia and Parkinson's show up, and we can test for that way in advance and make huge differences for that patient, not because we have the cure for Parkinson's, but we can absolutely slow its progress, and that's documented.
And that's just kind of one of the things I always say is that, we don't have Wi-Fi in our body. We are wired head to toe.
Yes, you got it.
And it's a lot of times we don't really think that, our nerve system, how it is, in order for you to understand what I'm saying, for your heart to beat, for your lungs to breathe, that is your nerve system functioning. And it's, when it's off kilter from all the things we touched on earlier, and you have that component that's lacking, it does not matter how often you go to Whole Foods. It does not matter. You can take the best supplements in the world.
Right.
If that system is impinged upon, then you're going to have issues. And unfortunately, much like dental cavities, they can lie dormant for some time.
And that's probably the biggest thing. And hopefully, if people are listening to this, they walk away with an understanding. I have to get checked. It's that simple. And the dentist, I think, I've probably done the very best job of any healthcare practitioner out there, teaching people, just get checked. If there's nothing there, great.
Awesome.
But if we do have an issue, let's address it, because if we catch it small, it's really not too big a deal. It's not costly. It's not time consuming. We have to get our kids checked. And what I say to my patients is this: listen, get the kids checked so they don't turn into you. Our parents maybe didn't know this or didn't have access to this information, but you do. And if you catch this when they're young, that's a big deal. And we know that the very first subluxation that usually commonly occurs at birth. And it's been linked to SIDS since the 1960s. Mm-hmm. So that's brainstem issue, and that's neurology, and that's breathing, and that's, everything you just said.
Yeah, and it's especially with the kids, we see it in the generation. I think statistically now, this is the first generation of kids that's coming out there that aren't expected to outlive their parents.
Right.
We know chronic disease is a major issue. I think 1 out of 4 kids are on a medication are expected to be on the rest of their life.
Right.
And it's just it's just terrible that it's gone to that level. So parents, if you're out there, I would heed his advice, because it is so important. Moving right along with this next portion of this, which I love, because much like you were talking about the takeaways that somebody can do for detox, I always ask the guest during this portion, what are 3 health nuggets that somebody can take right away to improve their health?
I say these every day, probably 4,000 times a day. You probably do too. The biggest thing we mentioned earlier is water. People are not well hydrated. And if you're not well hydrated, you can't function. So blood is 80% water. Brain fluid is almost 100% water. Bones are 20. Muscles are 70. If you don't hydrate, you cannot heal. So water, I think, is top of the list. Second, posture. If you don't posture correctly, we know for a fact that if you are a sloucher or you're sitting in your chair all day because of your job or something like that, if you have a leaned or head forward posture, the incidence of heart disease goes up 400%. That was a 20-year study. So it's not just neck pain, back pain, it's whole body function. And last is deep breathing. If I could sell deep breathing, I would, only because I think people take it more seriously. People go, well, I breathe, I'm breathing. The reality of that being that most of us breathe with our chest. And if you chest breathe, you're turning on the part of your nervous system that speeds you up and stresses you out.
It's huge.
So those are my big 3 that I'm constantly talking about.
Yeah, the water is just so important.
It really is.
So kind of going back to the future now, if you were to go back maybe 20, 30 years, because what would you tell your younger self? What are some things you might be able to tell yourself? We've all made mistakes. We've all kind of gone through adversity.
Yeah, I probably don't hesitate. I've come across a lot of this information, and I've been fortunate enough to be exposed to some people who are really, really knowledgeable, and probably taken a little longer than I should to have acted on some of that stuff. If people really had the opportunity or being exposed to this conversation and go, you know what, my daughter does have attention deficit. Maybe a chiropractor is a reasonable, eval. Or, maybe I'm going to consider changing my diet, or maybe I'm going to start detoxing or get with somebody who can walk me through that process because I'm holding a lot of extra weight or inflammation. I just don't wait. Don't wait.
Love it. So I want to fire a bunch of questions at you.
Yeah.
I call it the wow round, if you will.
All right.
Best advice you ever got?
I actually wrote that one down. I did get some pretty powerful advice once, and that was be humble. It's the older I get, the more I know that I don't know that much. there's so much great information. There's so many brilliant people out there, and that old cliche, we're standing on the shoulders of giants. We really are, especially chiropractic. A lot of the stuff that we're talking about now that people actually are coming forward for because of new information relative to concussion or attention deficit or something like that, or the neurology piece, is because other people did amazing work, and it's research-based, good, solid information, and we're lucky to have that.
Awesome. Next one. What makes you a health nut? What do you do day to day? What makes you a health nut?
You know what? Probably my deep breathing is definitely on my list. I've been in martial arts since I was 12, and I started off obviously with the fast as you can go, hard as you can be kind of activity, which is how I got most of my injury experience out there. But learning to breathe and slow down, exercising daily, it doesn't have to be intense, but moving every day. And just, remembering that your brain is as much a part of this process. And I don't mean just the physical brain, I mean your thought process. Keeping your thoughts in check is huge.
Huge. Best resource or resource maybe that you can turn somebody on to?
There's a ton of great information out there. Knowing where to look and who to contact it to really find that source, I think is where you need somebody that's a professional to kind of give you some insight. But to be honest, the Bible's a huge resource for me. I mean, I read it constantly because there's stuff in there about holding my brain in the right place, making sure I meditate and relax, making sure I have a healthy lifestyle. I actually go to that one a lot, to be honest with you.
Awesome. That's a good one. One of the best, if not the best out there.
Yeah. I mean, that's the one I go to.
Yeah. So lastly, somebody needs to find you. How they do it?
We actually are right in the process right now of revamping our website. So our website is just Family First Chiro. Sorry, that's the email. Yeah, you know what? I constantly get those two confused. It's familyfirstchiropractic.net.
Awesome.
And we're right in McMurray. You and I are sharing streets here, really. Yes. And I gotta say, this little corridor that we're in is full of some really good people. There are a lot of good minds in our area, which I think we each do things a little bit differently, but extremely complementary. And I think people have a lot of choices for good resources in this area. So, our website is there, and people are welcome to stop by anytime. We do classes constantly, just like you guys do. It's open. We keep an open door.
Love it. And so I can't thank you enough for sharing this knowledge and coming on. Maybe I can have you on again sometime.
I would love to. I had an excellent time. I appreciate you doing what you're doing. I mean, you putting this information out there for people and putting it into such an available format, it opens doors, and that's a big deal.
We can just change one life through all this, and it's all worth it.
You got it. Thank you.
All right, brother, man. I look forward to talking down the road.
You too. Thank you very much.
You got it.
So, you've heard from the experts yourself this episode and have gotten some golden nuggets on health. There is so much more to come and so much more to learn. Head on over to pghcw.com. Again, that's pghcw.com, and sign up for our newsletter where you'll receive free info on how to get and stay healthy. Thanks for listening, and we'll see you next time on Health Nuts with Dr. Chris Carr. Be sure to subscribe to the podcast and please leave a review.